Welcome to Learn with Nana. Today in this video, we'll be discussing all about arterial blood gas. What is arterial blood gas? What is arterial blood sampling sites? How is the preparation for arterial blood sampling? And the pre-analytic errors that can alter the accuracy of the blood gas results. Okay, so what is arterial blood gas? Arterial blood gas is a diagnostic tool that is used to assess the oxygenation and ventilation of the patient. And it is used to assess the patient's response to therapy or diagnostic tests. Now, what are the sites that can be obtained for arterial blood sampling? We have the radial artery, brachial artery, femoral artery, and dorsalis pedis artery. But the most common and the most preferred site is the radial artery. But why the radial artery? Because of all sites, the radial artery is more accessible, easy to palpate and stabilize. It has more effective lateral circulation, and the artery is not near any large veins. So how's the preparation before the arterial blood sampling? The equipment that needs to be prepared, we have to have pre-heparinized blood gas kit syringe. If the syringe is not pre-heparinized, we have to bring the sodium heparin, the one in the small bottle. We have to bring swabbing alcohol, sterile gauze or tape or bandage, eye slash, sharp container, towels, needle cupping device. But before we start, first and foremost, we have to check for collateral circulation. To do that, we have to do the modified Allen test. But we can only perform the modified Allen test for a patient who are cooperative and conscious. To perform the modified Allen test, the patient's hand is clenched into a tight fist and pressure is applied to the radial and ulnar arteries for 10 seconds. Next, the hand is opened. The palm and fingers should be blanched. Next, remove the pressure on the ulnar artery and it should result in flushing of the entire hand within 5 to 10 seconds. That indicates an adequate collateral circulation or a normal modified Allen test. If flushing of the entire hand is not seen, you cannot proceed to arterial blood gas sampling and you have to look for another site. And then you can now proceed to arterial blood extraction. I will show that in a separate video. Now let's proceed the pre-analytic errors or problems that occurs before sample analysis that can alter the accuracy of the blood gas results. So these are the pre-analytical errors that can affect the result of the arterial blood gases of the patient. With the first here we have is air in sample. It may give alkalosis result in the arterial blood gas. So to prevent it, we have to discard frothy samples and have another extraction. Also, fully expel bubbles by gently tapping on the side of the syringe to bring the air bubbles to the top. Then expel them by pressing the plunger. So next is we have the venous admixture. This happens when you have accidentally hit the vein and not the artery. So to prevent it, you should not aspirate the sample because you'll know when you hit the artery, the plunger of the syringe is forced back by the pressure of the blood. Also, you'll know it by its color. When you hit the artery, you'll get a bright red, and when you hit the vein, you'll get a dark red. Another error is too much anticoagulant. That is why, after aspirating the heparin, you have to flush out all of the heparin and also the air to avoid altering the arterial blood gas result. Or if you have a pre-heparinized syringe, it is much better because it has dry heparin. The next is metabolic effects. This will give us a result of acidosis, and this happens when the blood sample is not analyzed within 15 to 30 minutes. If the sample cannot be tested in at least 30 minutes, it should be placed in an eye slush to slow the metabolism and keep ABG results accurate. That is all for this video. I hope that you subscribe and you learned something from me, and see you in the next video. Enjoy the learning journey.